Hello. So if you're just tuning in, I'm an intimacy behavioral therapist. My name is Rebecca Tarosian, and I help people to find and use the tools from within their bodies to be able to give and receive touch with ease. And I help patients navigate and overcome many kinds of issues and challenges and problems from within their bodies. And I've been talking lately about underlying causes, and what now this has led me to is one kind of universal topic. I'll say it's many have written on it, talked about it, explored it, and that is trauma. And I'm going to talk about how that can show up in our bodies, in your body, and I'm going to talk about it, though, of course, exclusively from my point of view in terms of my firsthand experience working with many people who have struggled with it, and how it actually contributes to more anxiety, more dis-ease, more lack in the body, and being able to feel actually how it can cut one off. So, of course, just by definition, trauma is something that is experienced within people. It, of course, varies as to the extent and is relative to each person and their experience, how it happened. Usually it comes from some kind of experience that was completely overwhelming and has actually really lodged itself into the cellular structure and the tissues of the body, if you will, the muscular structure. And so while trauma, of course, the memories can be, of course, in the mind, they're also in the body. And I know this because I not only have firsthand experience in releasing trauma from the body, but I also have experience working with many people that through the power of touch and guided exercises and breath and sensation focus, which are the tools, trauma can actually come to the surface and be released. And it can show up as post-traumatic stress syndrome. It's very common. I won't go into all the causes, but there are many. And the way it actually can show up in terms of, often it's just the fact that it's in your body and it's locked down. So for many people, it means that they have trouble or they just don't experience sensation in those areas of the body, or when they do, it creates real. They get very upset and just it's just too uncomfortable. Maybe they might even. Well, it's interesting how the body protects itself. However, when one uses touch, it is possible to actually activate that area or whatever, that emotion that's being stored in the body, and it can bring it to the surface and it can be released. And there are several out there, different kinds of mind-body therapies that explore this, and I will go into that a little bit, but what I just want to say is that I have firsthand had the honor to work with patients that have been able to release that which was stored in their body that maybe they didn't even know was there until it was released through an emotion stimulated from touch. So that's just something to know. And again, I just emphasize that I'm speaking strictly from my own either personal experience, my own personal history, and or from when I'm talking about this subject, and or from the evidence that I've experienced, that has happened through the sessions in working with people in using breath and touch to release, intentional. So it's a mystery in terms of really why it's held, where it's held, and although once released, it is really obvious that it is now released. So I want to explore this a little bit more as I talk to you about more underlying causes, which is what the theme I'm on right now. What are some of the underlying causes that create the conditions for many of us to not want to feel like we at home in our own bodies, and even that the body may be betraying us. So I'm going to continue to explore this a little bit more. But for this moment, I'm going to keep these videos shorter and just have a continuance. So again, thank you so much for tuning in. Hello again, and I'm talking about trauma. So I just introduced it in the last video, and in this video I'm going to do something a little different, and I'm going to talk directly from my experience, about having experienced it firsthand, and also having released it. So I will share that when I was a little girl, between the ages of 6 and 10 or so, I was exposed to a pretty dangerous situation daily, which caused hypervigilance and a lot of fear in my body, and effects that I had no idea to what degree. At one point I had headaches that were tremendous, and couldn't find the cause of it, and my body just kind of broke down as a little girl. Fortunately, I was able to get out of that situation and move on. It did have lasting effects though, and I wasn't going to find out to what degree until later. One way it showed up is that by trade, I'm a dancer, professional dancer, and I found at times that I would freeze, and again, deer in the headlights in the middle of dancing. I didn't know where I was. I would also notice over time that parts of my body were like locked, that I couldn't, while I was physically able to execute certain movements or stretch and open certain parts of my body. I found that actually they became more and more on lockdown, like my upper back, my neck. I couldn't access feeling there, and I couldn't open or stretch through. They were like tightened. So one experience that really made it very clear to me personally that strong emotions are held in my muscular structure, was that I was receiving a deep tissue kind of massage, and I was just new to this particular practitioner and technique, and he was working actually into the large muscle, of the butt, basically the glute, right, the gluteus maximus, and it was just working into that muscle, and out of nowhere, I started to sob, and I did not have a memory, I didn't have a thought, it just emerged. I released it, and then fast forward, I was able to be a patient myself of a mind-body therapy called bioenergetics, which combines both talk therapy with I'm going to put this with movement and vibration, and putting yourself into, with coaching from the doctor, but being able to put yourself into positions physically where you can release through vibration and through movement what is locked in your body in different areas. There's a whole series of exercises that one is coached through, and there's a lot written on this if you want to look into it, bioenergetics. That said, I was in treatment for that for quite a while, and a few years, and I released so much. Another way that I released was through vibration, which was through sobbing, was through undulating, was through putting the body into a position where it was possible to access a kind of sob, which I was unable to do, was repressed, and so much came out of that. And that which was released felt as it was gone. I started to be able to access more parts of my body after that. And then there were others. Again, interest of time, I won't go into every single healing mind-body modality that I've experienced or I've practiced. However, I've practiced many, which have led me to create my therapy. That said, I'm speaking personally right now about what really healed me, and a few stand out. Another was network spinal analysis, which was really light kind of touching of the spine and releasing from there. And hard to describe, but it's a process too that, like anything that's healing, has to be repeated. And I was able to free up my upper back and neck and shoulders, and really so much of the pain and the need to, the sadness and the anger, so much of that was released during that period. So it's just to name a few. So I really developed confidence in the fact that the body is able to release trauma. And then, of course, I went on to create my own therapy, which is intimacy behavioral therapy, which I'm doing now. And through touch exercises and experiences with patients who held trauma, I found that that through the breath and the focus and the safe touch and the loving touch, frankly, of in the moment, would in many situations elicit an emotion or allow the great grief or rage or whatever was being held to come to the fore and to be experienced. And once felt, it can be released. There's a kind of cliche saying, but it really fits, which is feel, deal, heal, right? So we have to feel. When I say feel, really feel what's your actually sensation, and then, deal with that, in other words, acknowledge it and be willing to release it. And through that, healing is possible, meaning that one's not walking around holding so much within their bodies. I'm certainly freer in my own body, mentally, physically, emotionally, spiritually, than I've ever been, and it only continues. I have 100% confidence in that which we can't see or empirically prove in some ways, but more and more science and technologies, and I might say more science and sort of neuroscience and those kinds of things are now validating many of these kinds of concepts that just remained concepts, but in real time and in real ways are true healing paths, because we, in the end, heal through our emotions, not through our thoughts alone, and emotions can be elicited through the body. So I wanted to share that with you, and it is very hopeful and possible. So thank you.